Next speaker is Dr. Suyash Saoji, and the title is A Clinical Comparison of Postoperative Astigmatism in Suture and Sutureless Glueless Pterygium Surgery.
Good morning everyone. My paper presentation topic is a prospective clinical comparative study to assess post-operative astigmatism following suture and sutureless glueless pterygium excision. Pterygium is a degenerative condition characterized by triangular wing-shaped growth of fibrovascular tissue from bulbar canira over the cornea. Pathogens include damage to the limbal stem cell and activation of matrix metalloproteinase leading to invasion of the corneal and destruction of the Bowman's layer and superficial corneal lamina. As pterygium advances, it distorts cornea and resulting in significant astigmatism and visual improvement. My aims and objectives are to study the keratometric findings in pre-op and post-operative pterygium cases, to study the correlation of astigmatism with various grades of pterygium, to compare astigmatism after suture and sutureless glueless pterygium surgery. I have included all the grades of pterygium and age of patient above 20 years. I have excluded the patient which have recurrent pterygium, age less than 20 years, any history of ocular morbidity, and any patient having ocular surface pathology with corneal pathology like edema, opacity, previous corneal refractive surgery, and degenerative dystrophies. The study was prospective comparative study conducted in the Netaji Subhash Chandra Bose Medical College, Jabalpur. My sample size was 40 eyes were examined. I have divided the patient into two groups, suture, group A suture and group B sutureless glueless pterygium. Keratometric findings were measured with keratometer pre-operative and post-operative on day 1, day 7 and day 30. Relevant history of diminution of vision, pain, foreign body sensation, redness, photophobia, headache was taken. Any previous surgery history was taken. Associated systemic illness, chronic illness history was taken, and history of trauma also was taken. On ocular examination, visual acuity was recorded. Inter-segment examination was done with slit lamp examination. Results of my study are, in my study shows the out of 40 patients, most of the patients are male, that is 28. In age distribution, most of the patients belong to 40 to 60 years of age. And both the study groups are suture and sutureless. Equal patients are divided into two groups. Most of the patients shows the grade 2 pterygium, which are approximately 28 patients shows grade 2 pterygium. This chart shows the pre-op and post-op comparison of astigmatism with and without suture in study. Highest astigmatism seen more than 3 after pre-operative, and it gradually improves over time after surgery. On post-op day 30, on post-op day 30, maximum patient showing astigmatism of less than 1 diopter. This chart shows the comparison of astigmatism with and without suture. In suture group, pre-operative mean astigmatism was 3.2, which gradually reduces after post-operative to 1.2. And in sutureless group, mean astigmatism pre-operative was 3.2 and which was reduces to 0.9. Most of the patients with grade 3 pterygium have maximum astigmatism. This table shows the visual acuity measured on pre-op and post-operative, in which visual acuity is improved to 6/18, which was due to decreased astigmatism after surgery. In my study involving 40 patients divided equally in two groups, astigmatism were measured pre-op and post-operative on day 1, day 7 and day 30. Pre-operative, both the groups shows the mean astigmatism of around 3.5 diopter, indicating for surgical intervention. On post-op day 1, patient in the sutureless group had a mean astigmatism of 2.1 diopter, which is significantly lower than the suture group, which has 2.8 diopter. Sutureless technique may reduces immediate post-op astigmatism more effectively. On post-op day 7, the trend continues with the sutureless group showing a mean astigmatism of 1.5 diopter compared to the 2.2 diopter in the suture group. On post-op day 30, the sutureless group had a mean astigmatism of 0.9 diopter, which was while the suture group shows 1.2 diopter. Conclusion. In my study, most of the patients were male. Most of the patients had nasal pterygium with grade 2 severity. Post-operative, there was no recurrence. Study indicated that the sutureless techniques are superior in reducing post-op astigmatism. Sutureless glueless pterygium excision surgery results in less post-operative astigmatism and also improves visual outcome with faster recovery compared to traditional suture technique. These are the references. Thank you.
Dr. Suyash, what is the novelty in this study, because there are so many studies like this?
Yes, sir.
Okay, now coming to the astigmatism, so what was the follow-up and it reduced to which level?
Sir, it has reduced on post-op day. It reduces slightly.
So you have taken only post-op day 1
day 1, day
astigmatism.
7 and day 30, sir.
So what was at day 30?
Day 30
average?
Gradually reduces, and it has a 0.9 diopter astigmatism in suture group, and sutureless it has a 1.2 diopter showing in mean.
So you were able to do keratometry in the grade 3 also?
Yeah,
because
sir,
sometimes it is not
difficult,
possible.
Sir. Yes, sir, it's so difficult. Sometimes it should no target only.
Okay.
What type of astigmatism was seen on all your cases? Is it with the rule or against the rule?
Sir, with the rule
astigmatism?
astigmatism.
With the rule
Yes,
astigmatism.
sir.
And suture, usually you use observable sutures.
Yes, sir.
Yeah, usually they get observed in a month, 6 weeks times.
Yes.
So what is the rationale or the hypothesis behind getting astigmatism reduced with suture and sutureless?
Sir, with suture, it has some tension and it shows that the sutureless is better than suture.
So how is better you?
Sir,
Sir is asking how this suture affect the astigmatism.
sir, it causes tension and so astigmatism is more than.
Okay.
Thank you, sir.
Any more? Any question?
Thank you, sir.
Thank you.